Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication used to treat depression. Its name is Vilazodone. It has a brand name of Viibryd. Before we get into the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source of recommendations for your personal health care. So Vilazodone is a new antidepressant that actually has two mechanisms of action. One is that it's a partial agonist of the 5-HT1A receptor, and it's also a 5-HT reuptake inhibitor. When these two mechanisms of action are compared, the medication does have a stronger affinity for the 5-HT1A receptor than it does for the reuptake pump. 5-HT1A agonism produces a more rapid desensitization of the presynaptic 5-HT1A autoreceptors. This potentially results in a more rapid antidepressant effect. Now, in terms of dosage form, this medication is available as tablets. It comes as a 10, 20, and 40 milligram tablet. I do typically cover multiple indications for each medication that I talk about on this channel. However, for this medication, the only indication is for depression. Now, before somebody was to start using this medication, there are some precautions that must be considered. One is that if somebody's using a medication that's a strong inhibitor of the CYP3A4 system, that could cause an increase in plasma levels of Vilazodone. Now, looking at things from the other side, if somebody was using a medication that was a strong inducer of the CYP3A4 system, that could cause a decrease in plasma levels of their medication. This medication was associated with a black box warning, advising the public that this medication can cause an increase in suicidal ideation, especially in adolescents when starting the medication. Because this medication does have an effect on serotonin, if somebody was to use this medication with other medications that also affect serotonin levels, they could be at an increased risk for serotonin syndrome. The seizure threshold may decrease with this medication, placing patients at an increased risk of having seizures. If somebody was using this medication with bipolar disorder, they may be at an increased risk of experiencing hypomania or mania. Hyponatremia or low sodium levels was reported with this medication. And lastly, it's recommended not to stop this medication abruptly if you are coming off of it. The best thing to do would be to decrease the dose slowly over time. You can speak with your physician or pharmacist to help you with this. Now, once somebody is made aware of the precautions and they start using the medication, they would typically start off on a dose of 10 milligrams daily. They would take this dose once a day for 7 days and then increase the dose to 20 milligrams daily. After another 7 days, the dose is usually increased to 40 milligrams daily. There are no dose adjustments required in renal insufficiency or moderate liver impairment. One thing that's important to note in terms of dosing with this medication is that it's very important to take it with a meal. This is because the absorption of the medication is decreased by 50% in a fasted state. After somebody was to take a dose of this medication, it would reach peak plasma concentration levels at 4 to 5 hours post-dose, and its half-life is approximately 25 hours. Now, as with all medications, there are some side effects or adverse reactions that people may experience, so I'll list some of those here for you now. Nausea, vomiting, diarrhea, and insomnia seem to be the most common side effects seen with Vilazodone. They come in at a rate of 5%. Dizziness and lightheadedness were seen. I did mention that some people experience insomnia. It's interesting to note that others experience fatigue. Some people notice heart palpitations, and gastroenteritis has occasionally occurred. One positive note with this medication is that there's actually less sexual side effects than there are with SSRIs. There is limited clinical experience regarding overdose with Vilazodone. There has been 4 parents and 1 child who have overdosed on the medication, but they all recovered. One thing that should be noted in each situation of overdose, the doses were between 200 milligrams and 280 milligrams. These patients presented with serotonin syndrome, lethargy, restlessness, hallucinations, and some disorientation. That's all we're going to discuss today with Vilazodone or Viibryd. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow the channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. Alright, that's it. Take care.